I'm with Mr. Nihal Ratnayaka, who is the Chief Operating Officer at Asiri Central Hospital. And this is the pinnacle hospital of the Asiri group of hospitals. There are, I think, 6 hospitals in the Asiri group.
Yes, doctor.
And then you are touching many lives on a day-to-day basis.
Yes.
And what have you got to say about Asiri group of hospitals?
Well, doctor, just to talk about our group, we have been in existence for more than 4 decades.
Yes.
So, and we have 6 hospitals in 3 provinces.
Yeah.
All our hospitals are internationally accredited.
Right.
And also, we do the largest number of brain surgeries. For instance, we have in the last 10 years done more than 10,000
10,000 brain surgeries.
And also, we have 3 cath labs in our hospitals, doctor.
Mm-hmm.
So, we as far as experience is concerned, we have done more than, if I may just, I have written down some of the numbers.
Yes.
So we have done, we do more than 800 heart surgeries for a year.
800 heart surgeries, open heart surgeries.
Open heart
as well
surgeries
as,
and invasive,
invasive procedures.
procedures as well. And we do 6,000 angiograms.
Oh, right.
So our numbers wise are huge, doctor.
Yeah.
So we are the largest by any form, and
Yes.
also we have the largest laboratory network in the country.
Absolutely. You have been masterizing your lab services from the very beginning, no?
From the beginning, doctor.
And therefore, I think, I mean, you're touching many lives on a day-to-day basis.
Definitely,
therefore, there are a lot of
doctor.
good which is created in the country.
Definitely.
And I think Mr. 𝐾𝐚𝐲𝐿 should be a proud man.
Of course, doctor, with this vision,
Absolutely.
we have been sort of, reaching out, and also we do get involved in a lot of community projects also,
Right.
where we do CSRs as
Absolutely.
well.
Absolutely.
Because
I think in a business, if you can touch many lives, make people happy,
yes,
and then also, when they come physically down and mentally down,
Yes.
and to give them some relief, I think
Definitely,
that's a
doctor.
big meritorious act.
yeah.
And I mean, how do you manage all the different professionals who are coming to the hospitals? That's a difficult task. Even
Of
for the
course.
government, it's difficult to manage professionals.
Of course.
And what's the special things in Asiri do to keep
So-
the professionals with you?
Yes, doctor. So I think what we do is we make sure that everybody feels that they belong, they're part of the Asiri family,
Absolutely.
which is the
Ownership.
culture,
Ownership.
and also we are very popular for our nursing. So
Nursing
as you
care
know,
as well, yeah.
the post care is very important.
Absolutely. It's a
And that
teamwork,
it's a teamwork,
Yeah.
doctor. And I think we have generations that have been working in our hospital. So people are proud to be part of the Asiri
Asiri group,
hospital.
Asiri
Yes,
group.
correct.
Now with the new government also, I think there's a lot of boom in the sector today. Or can you say
Definitely,
that?
doctor. So I think with tourism also
Yeah.
increasing, we do see a new footfall
Right.
of tourists also patronizing our establishments, and
Right.
that's a new opportunity.
Absolutely.
I feel that we can,
Yeah.
because we have the strength of having qualified doctors
Yes.
and nurses, which
Yes.
is a scarcity in most countries in the world today. So we
And-
can really leverage
Yeah,
on
and your
that.
infrastructure is very good. Huh?
It's very good,
Very
doctor,
good.
and we are willing to invest also
absolutely.
in anything which is new. So
Yeah.
I think we are very optimistic about the outlook. Yeah.
Therefore, congratulations.
Thank you, Doctor.
And
Yeah.
always you have been a great partnership for the Medicare National Healthcare Exhibition.
Yes.
And in fact, that's a huge achievement. And I think this time we want to see a lifetime award being awarded to Mr. 𝐾𝐴𝐲𝐿, if possible, because he has done so many good things for healthcare,
Yeah.
which is not recognized. I mean, comparatively by name.
Yes.
So that's another thing that we want to do, because in Medicare, what we do is that we get all the top providers under one roof, and then also give them enough recognition that they should get. It's a recognition which is due recognition, not an undue recognition,
Yes.
which is for the good work happening in the private healthcare industry in the country. Thank you, Nihal.
Thank you very much.
Thank you very much.